Hi, and welcome to How Humans Heal. I'm really excited to introduce you to Dr. Nasha Winters. She is author of The Metabolic Approach to Cancer. She's also the founder of Metabolic Regen University. She has a metabolic approach to helping people to prevent and address cancer. And I'm so glad for you to be here with me today, Nasha. So good to see you.
It's so good to see you. As we were saying before the recording, it's like we've been trying to do this for a while, and I'm glad that the opportunity arose. So I'm glad we're doing this with you and your amazing community.
Thank you. Yeah, like as naturopathic doctors, like our paths have crossed so many times over the years, and it's like, and to be like knowing, hey, we're out there, with sharing this message that health can be getting into the root cause, figuring out what's going on under the surface, and helping people to understand what that means in terms of what they can implement to actually make a difference, especially related to cancer, right?
Yeah.
So thank you so much for everything you do and everybody that you teach, because you've been teaching around the world
Yeah.
in lay audiences, professional audiences, and what a brilliant teacher they have. So thank you for all of that.
Oh, thanks so much. So fun.
So maybe share a little bit about like if there's something that inspired you to go this direction with helping with cancer and what that looks like. What is that? Just so people get a better sense of what does that mean to be a metabolic approach to cancer.
Cool. Well, I feel like it's always, context is everything for me. I'm a story collector, I feel like, when we're working with our patients. And though I haven't been in private practice for several years now, I still support other doctors in private practice. So I feel like I get to be like the secondary, like second string team of clinicians to support that process. But for me, it started with my own journey. It's interesting, Donnie. I was, just to give a little background so people understand the terrain, my environment. At 9 years old, I started menstruating. This is in 1980, right? Not normal or common.
Mhm.
By the time I was 11, they put me on birth control pills to deal with my endometriosis.
Oh my
By the
goodness,
time I was
11.
4, mhm. By the time I was 14, I had my first bout of cervical dysplasia and had cryotherapy. By the time I was 16, I had another bout and more cryotherapy. So I kept getting CIN 2 and 3s. By the time I was 19, I had a collection of diagnoses of rheumatoid arthritis, IBS, knew I had thyroid stuff, but we didn't know for still a few more years that it was Hashimoto's. Didn't know for a few more years beyond that I actually have celiac disease. So it was like all these health things, and along with these hormonal imbalances. What I wasn't putting together and what my medical community wasn't putting together was, why would a 9-year-old start off with all these hot messes? And so it's a little vulnerable to talk about this, but I come from a lot of trauma and abuse, and those questions weren't being asked. And I think that's part of what I love about what you and I get to do. We want to know the biography of our patients to understand their biology even better. And had someone, I can very much remember Mrs. Richardson in my third grade class was the only person who seemingly said, "Honey, is there anything going on at home?" Like when I was not, I was at school when this happened. I was traumatized. All my third grade class was traumatized. It was like a thing that still today, I mean, I just ran into one of my classmates that I hadn't seen since then, who talked about how traumatized everybody was from that experience. And so it got quickly buried, and then no one was asking. We didn't know back in, the mid 80s, late 80s about HPV and its impact to cervical cancer and cervical dysplasias. So no one was testing for that. It would still be another probably decade before I was swabbed to see that I did carry some HPV variant. And so it was those kind of things that made me just go, yeah, there was a problem in the building and no one was addressing it. We just had a script pad for that and we moved on. So now you have context that perhaps it won't surprise you and your listeners that at 19, I was a sophomore in college, the summer before my sophomore year, kept getting in and out of the emergency room saying something's different, something's wrong. And they just kept saying it's your IBS flaring, it's your PCOS or your endometriosis flaring, it's your rheumatoid arthritis flaring, it's your celiac. Well, then we know celiac, but they're like just the IBS stuff. So it just kept getting sort of deferred. until my roommate found me unconscious and rushed me to the hospital or to the emergency room. And lo and behold, I had a different doc on that night who took one look at me and knew this was not more of the same. This was definitely something problematic. And so just to rush the story forward a little bit, on October 21st, 1991, I was just the 2 weeks before I landed in the ER was 2 weeks before my 20th birthday. My actual diagnosis would take 3 weeks after my 20th birthday. So my birthday was September 30th, 1991, 20 years old. On the 21st of October, 1991, I was diagnosed with official diagnosis of end-stage ovarian cancer. And so that was the why. I mean, really, that's where we are today. And because I was so sick, I landed there. I had 100% bowel blockage. I had a grapefruit-sized tumor in my right ovary. It shut off my ureter, so my kidneys were in failure. I had tumors all over my liver, all throughout my peritoneal cavity. My pulse oximetry was in the 70s. I was severely malnourished. I had a huge belly full of malignant fluid. And they said I was too sick to even have a single dose of chemotherapy. So they sent me home for palliative care. And
Oh my
yeah,
gosh.
yeah. Oh, and so for me, I didn't expect to fight it. Donnie, I didn't expect to beat it, fight it, battle it. I just wanted to understand why it was missed. I wanted to understand why a 19-year-old, now 20-year-old would have ever had this diagnosis, because it was absolutely unheard of at that time. Unfortunately, that's not the same today. But that is what set me on my why. And so for the past nearly 34 years, I have explored the why of my own process to then apply that to other people to understand their process, and now to teach doctors to learn that about their patients' process. So it's been a really interesting and long, circuitous journey.
But you're still here.
I am. Don't mean to ruin the end of the story, guys, but I survived.
You
Yeah.
figured something out because they weren't helping you at all, it sounds like. They just were like, "Okay, we can't do anything."
No, no. And it's interesting because there were a lot of accidentals of this time, which of course you and I, and I'm sure your listeners all know, probably not accidental, right? One of the best things that could have happened to me was a bowel blockage, because it forced me to fast. I couldn't eat
Ah,
for, 2.5 months. I could not eat 2.5 months. And so that often freaks
wow.
people out. And yet there are plenty of centers around this country and around the world who do long extended water fasts under medical supervision for 40 days and longer, and 80 days. And the longest recorded faster was I think 386 days. A man who fasted that long and completely dropped like half his body weight and all these other things under medical supervision. He's in all the medical textbooks on this. So I think that was one of my accidentals. My other accidental was starting to deal with a lot of the trauma of my life. And luckily I was in another state away from my family of origin. And so I could go into hiding, basically. And I did for 2 years. I called it the family fast. So I was fasting in a lot of places in my life. And then another accidental piece that happened is, when you're told that you're going to die in a few months, you kind of go into the, what I like to call, and forgive me, the fuck it phase. And in that place, on the night of my 20th birthday, still didn't have the official diagnosis. But I knew it was bad. They knew it was cancer. They didn't know. I didn't tell anybody. The only person who knew was my roommate. And on the 20th birthday, some people showed up at my house wanting to party, and I refused. But they said, "Well, we've got mushrooms," and this curiosity thing happened. Now I knew I couldn't swallow them because I knew I'd get really sick. But I asked if I could just chew them and keep them on my mouth, and if that would still do the job. And they said yes. So, funny story. They weren't looking. They just said, "Eat them." I didn't know what that meant. So I ate an entire baggie of them, chewed on them in my mouth like a little chipmunk with my cheeks as fat as could be, when they turned around and realized I ate the entire baggie, or was chewing on the entire baggie.
You had a big dose of
I
psilocybin.
did. I sure did. And we guesstimate today that was probably around 10 grams, maybe 12.
Okay.
So a heroic dose is above 3 grams.
Yep.
I don't know what, but I could tell by the look on their face I had done something really wrong. And let's just say my life would never be the same after that experience. So that was 2 weeks before. And luckily for me, I think it helped me face my mortality when they gave me the official diagnosis, because that's where the studies have been today in the use of this in terminal patients. So it gave me a different perspective. It took away any fear of death, but it also, for me, lit a pilot light of actually wanting to live, because I was very on the fence about that for quite a while. And so,
Wow.
yeah, so that was an interesting lead up. And you talked about, how did I get into the metabolic side of things? Well, that fasting was what kind of cued me in and started going down the rabbit hole of why was I needing to get the fluid drained less and less the further out I got from eating. I was still pre-med, so I had some, scientific mindset, but I was not reading anything that explained what I was experiencing. I didn't understand until many years later that I was lowering massive amounts of inflammation and these little, cytokine molecules. I was taking the pressure off trying to spend energy on digestion. Instead, it was working on healing up other parts of my body. When you get to a certain state, in a fasted state, you get pretty still and calm. And I had a very long life of extreme stress and duress, and it was probably the stillest, calmest, safest I'd ever felt was in those few months after that diagnosis. So I'm sure that rewired a few things in my being. And so those were just some of the big things that I think bought me enough time and like kicked the can down the road enough to just keep learning. And frankly, that's what I've been doing ever since, because it's, standard of care would probably never even say I'm in full remission, right? That there's still stuff in my body, but I've learned over 34 years how to live very well with this condition and not like force anything on it, not expect to cure. I actually don't like that word cure. I think it's really misleading for people. Um,
I'm so
yeah,
glad you're bringing that up because a lot of times people will say to me, I want a cure, or and as practitioners, we learn we have to be very careful about, not using that term for legal reasons. However, you're right now mentioning it more in terms of like, hey, is that really what we want?
you will. Mm. Or is it even like, what is our mindset around what is a cure? Like for me, thriving, thriving with something is more important than just surviving something.
Yes.
Like there's a very different, subtle, but it's big.
Definitely, because it's sometimes I think as humans, right, we get attached to a certain outcome, and to
Yeah.
the extent that we're attached to an outcome, that's in the whole different energetic relationship with our body, with the process. But when we can kind of get into this other pathway where we're not so attached to the exact outcome, we're attached to more like the experience that we're looking for, right? That I can be
Yes.
thriving, like you're saying, I can be living my life and so doing my passion and my purpose, then that's a different goal and mindset.
Totally. I think you nailed it. That attachment to the outcome. I've done this for long enough now in my own life and for, at this point, tens of thousands directly and hundreds of thousands indirectly, to know that there are so many people out there that are so afraid of dying that they're absolutely not living.
Hmm. Yeah,
And
even
that's
without a diagnosis of cancer, right?
absolutely, like, this conversation could be anything, Bill, like, that's what's really wild, is that we're so, like, missing the opportunity to truly, truly live.
And when you had to face death at such a young age,
Yeah.
and plus, yeah, like, I love that it's amazing, really, Nisha, when you think back, like, how did that like, you called them accidents, but these
Yeah.
combination of things that, fasting, of course, because your bowels were completely shut down, but okay, fasting, and then, so you like, I love this, you're having a fast physically, a fast emotionally, and then you bring in psilocybin, and I'm so glad you're bringing this up because as listeners know, this is something that I also love to talk about because there's so much research on it now. It's
So
becoming
much.
so clear that not like you said, not only does it help with end of life, but it helps with trauma recovery.
Extreme, extreme. I'm pretty certain, I mean, I know if you just from your work and even what you're I mean, behind you, the stress reset for health, one of the biggest stressors is what you're exposed to in your early childhood. So the adverse childhood events. And so when we take those quizzes, they always explain, and I'm sure you've had this conversation a million times over, but you are literally rewired differently in how you meet stress. Your microbiome is wired differently. Your neuroendocrine system is wired differently. And when you have been exposed to a certain amount of stress at a very young age, it sets the sort of the foundation for how you meet the world in your older years. And so for me, my ACE score was a 10 out of 10. And so it's like, of course, now medically and clinically and intellectually, I can look back and be like, duh, of course you had cancer, but it's like, oh, that accidental overdose of the psilocybin and the accidental fasting and the accidental, I'm just going to fast from the family. It completely rewired everything in me. And that gave me an opportunity that I would otherwise not have had.
Now, I want to be clear that we don't recommend that you go listening. Don't go do this.
No, please God, no, because I would not recommend it ever. I've never done it since, and I would never recommend it. It was not for the faint of heart. And I was so, so sick at that time as well. It's actually a miracle I did survive that. And so, yes, please, no. There are so many good facilitators out there who know how to work with microdosing, appropriate dosing, even macro or these heroic dosing in very safe, supported environments. And there are some brilliant like researchers out there doing it and clinicians, and there's training for clinicians. Find those people if this is speaking to you.
Yeah, I'm just completing the IPI program, the Integrative Psychiatry Institute uh, psychedelic assisted therapy training,
Mhm.
and including, being able to be certified where it's available in psilocybin, because I see, like, I once I started seeing the potential ability to help with stress and trauma recovery, I'm like, I want to be an advocate, and how better to be an advocate than to get trained and certified and be able to move forward accessibility to things like the psilocybin as a psychedelic therapy for helping with situations like that. Because what you're saying is, like, I really want to highlight, which is, I love this because this is what I always love to talk about. This has been my passion in research as well for decades, which is to understand that it's the stress and trauma that we're exposed to from childhood, even before we were born, that's
Mhm.
that's related to the health issues we experience. That, yes, we can know our genetics and our genetic tendency, but our genetic tendency is turned on by the stress and trauma exposure.
Exactly. Exactly. First of all, I did not know you're doing that. So when you come on my podcast, we are talking about that too. How amazing, because this is, I look at in the United States, we are the only country in the world that are not experiencing stable or improving longevity. In fact, we're the only country in the world where we are losing longevity. And we've been doing so for now going on 6 years straight. We're dropping. And the scientists call it this phenomenon of why we are losing longevity compared to the rest of the world. They call it the era of despair. And so when we look at the biggest crisis in this country, in the United States specifically, compared to others, it's everywhere, but here it's super concentrated. People die, our longevity is from opiate overdose and suicide,
Yeah.
which means we are a nation in pain.
Emotional pain and physical pain.
Exactly. And they really don't not they coexist.
They're completely
Yeah.
related to each other. Absolutely.
Yeah.
Absolutely.
Yeah.
And I'm so glad you're saying this, because that's the thing that we tend to want to, like, oh, that's somebody else over there. We tend to kind of like try to put our blinders on and ignore it. And yet this is an epidemic of
Yes.
of physical pain, and then people thinking that the only solution is opiates
Yeah.
and pain medications,
Yeah. Yeah.
and emotional pain, which shows up as depression, anxiety, and suicidal ideation. And
Yeah.
then, and this, how are humans going to survive if that's the only option?
Right.
And if
Right.
that doesn't lead to death, then the cancer develops.
Exactly, exactly. These other chronic illnesses, including cancer, just are ripe to set roots in that environment, in that system. And so when I look at all the pharmaceuticals we divvy out to folks in the state of pain or in this, physical pain or the state of emotional pain, and we have substance and substances that we have co-evolved with since the beginning of time that are like a creation, like they're like our true north. They like help us remember who we are, and they help us reconnect with ourself and the universe around us. It's incredible to me that we would classify them as type 1, classification 1, saying there's no medical benefit, there's only addiction around it, and yet that's completely untrue. And that's what's been unraveling since the 1940s, when we put a fake label and a fake claim over these medicines we've co-evolved with. And it's so interesting. I've got the original Merck manual. I think it's from 1915.
Wow.
And it's loaded with like, here's where you're taking poppy for, your pain management, but it wasn't in the synthetic form. So you weren't having the overdose. And here's where you're taking cannabis, for your pain management or your nausea or your anxiety. All of those were in the pharmacopoeia, including psilocybin, well, not psilocybin then, but some of the derivatives within some of these, medicines, DMTs and whatnot that they were taking. We just buried that knowledge, and like an entire generation or two created a whole new dialogue around it that's absolutely false.
And I want to point out that what we're talking about here is what you often refer to as the terrain. Like
Yeah,
maybe you can, because explain that term and how you use it for both patients and professionals to understand this concept of we got to look deeper, right? Than just what's that quick fix that's going to be not really a long-term fix.
exactly, exactly. There's a couple metaphors out there that you and your listeners have probably come across, like the one image of there's the fishbowl, there's a goldfish swimming inside, and it's really murky and crusty, and standard of care would look at that and just say, oh, we need to just add some bleach to the water,
Mm.
right? And that'll take care of it. Well, it does. It clears it right up. But all that sediment falls to the bottom, and then we'll eventually get all perturbated into the water again, and that poor fish just got a big old hit of bleach, that maybe it survived that, but then when they have to bleach it again, maybe it won't survive that on the next round. Another analogy is like if we all just had a window off our kitchen and we took all of our scraps and we threw them out the window onto the ground. That's great. Perfect, great. It's out of sight, out of mind, no problem, nothing a problem. But then a couple days later, you start to notice a little smell. Maybe a couple days later, a couple flies swarming around, and you get out the fly swatter, and that seems to do it. But it gets worse and worse, more and more flies, and then you start to spray that the whole bit. This is standard of care, guys. This is disease management. Whereas naturopathic doctors, integrative functional medicine doctors, we learn to go to say, well, wouldn't it have made more sense just to move the trash pile? Get rid of the trash pile, or actually take everything out of that bowl, clean it, and put in fresh resources, and have that fish in a safe haven while you're cleaning things up, and plop it back into a cleaner environment. What happens then? That's what we get to do. That's what I get to. I get to go through and explore what is causing the muck. What's causing the flies to be attracted? What's causing the cells to go rogue? What's causing the expression of disease to go rampant?
Yeah, and it's to say, like, a lot of times we're focused on the tumor with cancer,
Yes.
for example. We're so focused on the tumor as if that's the real problem
Yeah.
when that's the messenger. That's the messenger to say, hey, there's a reason why this tumor's here.
Exactly. And we're discussing a case right before this. It was such a perfect example. This young woman, she has the tumor removed, and like great. It should be, and the type of cancer she had, very, very should be perfect, right? Like standard of care says you just remove that and you're done, you're good to go, ring the bell, go back to living your life, you're fine. And that wasn't the case for her. And actually, it's not the case for most cancer patients. It will find another place to express, as it did with this young woman in a short period of time. completely away from the original site of where the tumor originated. And that is such a perfect example. It's like you cut that out, but you didn't change the environment in which it originally grew. Now there's an opportunity with this person to come back, and luckily they're into it, they're interested. Now we need to come back and help her understand her biography that led to this biology, as well as the environment both in, on, and around her, including people, places, and things that might have impacted her terrain to allow something like cancer to take root.
And what comes to mind as you're describing that is that it might not be right local to where the tumor is, right? It could be because our bodies are all interconnected, but that doesn't get picked up on in standard medical approaches.
No, and the type of questions that you and I would ask, I mean, people are going to probably frequently hear this. I have a 54-page intake form for my patients with cancer, or, that when I train the clinicians to use these in their practices. Part of that is it's a journey to self, right? It's a deep, deep dive evaluation. But we also want a lot of information. We want to look at, of course, your symptoms. We want to look, of course, your diagnoses, your medications, your supplements. We want to look at your family of origin history. We want to look at all the zip codes you've lived in the formative years and the transitional years of your life to know what exposures you had. We want to know about your belief systems. We want to know about your ACE score. We want to know about your environmental intake. We want to know about even your doshas, your Ayurvedic doshas of like the patterns that you were born with versus the patterns that you express from changes in your diet and lifestyle. And we want to learn about like even your Chinese medicine constitution. And even we have some questions in there that really show us a little bit of sort of the homeopathic constitutions as well. So we have a really clear story of what pattern is expressing. And is that your true essence? Likely not if it's expressing as disease. So how do we get under that to find your true essence and help you return there as quickly as possible?
Amazing, amazing. And I find this too that in the process, patients, or I'm thinking of women with HPV that I'm helping to prevent cervical cancer, they end up learning so much about their health along and themselves along the way. And not only are they then preventing cervical cancer in the case of high risk HPV, but they're ending up preventing all other health issues because
Exactly.
it's related to the same situation. It's the same thing.
Remember when I mean, you and I have been, when did you graduate medical school?
In 2000.
So I should have graduated in 2000, but I went and finished my doctorate in Oriental medicine first and then finished in 2003, but similar window.
Yes.
And the HPV vaccine was just rolling out shortly after that. And what we'd all been taught in school was HPV is very much a terrain issue,
Yeah.
right? We were taught that it's about certain risky behaviors, certain lacks of micro and macronutrients, certain like like lifestyle choices. That's what, if you address those, you could do something about it. And then we had teachers like the Tori Hudsons of the world and whatnot that were teaching us that if you literally, place these little um, badge packs, these little like
Yeah.
compresses to the cervix, you could heal locally. But then there were a lot of things we were doing to heal things from orally as well. For my practice in the beginning in tiny little Durango, Colorado, in the Four Corners, I probably myself, if I had to guess, I probably administered over 250 different patients for escharotic treatments.
I love knowing that you've been doing that too over in Colorado. And I was doing the same thing in Manhattan and this area, the Manhattan, Connecticut area. Because it's like
And yeah,
it's like we learned how to do escharotics in our training.
totally. So while to your point, like we were helping those high risk HPV patients, we were resolving it entirely, getting clear paths. We were getting clear paths within a month from these types of treatments. And then we would maintain them because we've changed the environment. We've educated them. We've got them the oral support. We've taught them how to deal with the local support ongoing, that they don't end up turning into cervical dysplasias or cancers in the future. And then along comes a vaccine that took all of that away from us, that basically all of these folks were taught to believe that just a shot would prevent it. And it took away that opportunity to educate and empower, at this time, women of how to really tend to their terrain to prevent that from happening, because even you and I know it's like that vaccine is still only addressing a few of the variants, right? And there's
Exactly.
dozens out there. And so I just think it was such an interesting time. We've been at it long enough. And yet those patients that I still come across in my practice today that guess what, have cervical cancer, even though they had the injections, no one taught them how to take care of their bodies.
I know how scary it is to test positive for HPV virus, and I know it's even more concerning when your gynecologist tells you that all you can do is wait and see if it continues and if it causes abnormal cells. That's exactly why, as a naturopathic doctor and midwife, that I feel so passionate about helping women to be proactive about protecting themselves from HPV virus. I've been helping thousands of women for the past 23 years to do exactly that and to get HPV to negative and stay negative. And that's why I developed the Say Goodbye to HPV online program, where you can get access to my proven protocol from wherever you are in the world. So I hope you will come check out the Say Goodbye to HPV program, review the success cases, and see if this is going to be a good fit to help you get your life back from HPV.
And
Well,
I
this
feel
is
like that's so
exactly that.
sad.
It's I hear these stories because now I'm talking to thousands and thousands of women every year in these situations, and that's one of the there's trauma happening to women because of this point and others where it's, oh, just get this vaccine and you're going to be fine, and then what happens then, that once, because you're right, it only covers some of the high risk types, so women can still, and it's only partially effective even to all the ones
Exactly.
that it does cover. So then women end up positive for HPV anyway, cervical dysplasia, and they're like, "Well, the doctor told me this was supposed to not happen. Now what do I do?"
Yeah.
Um, and so now they're in a situation, and a lot of people, because they're told, "Oh, some humans are even judgmental to other women. Oh, you were supposed to just get the vaccine, or oh, that, and so we end up in this battle against each other about something that is completely missing the point, which is that wasn't going to be solving it anyway. Or the
Exactly.
cases where, I mean, I was talking to a woman this week, and I've heard this story, unfortunately, so many times, where women are go for their PAP, right? Luckily, we have a way to
Still
go in
going. Yeah.
and be identifying. Now we're testing for high risk HPV. Most practitioners are when women go in for their PAP or annual exam, and so, but that means that more and more women are finding out that they are testing positive for high risk
Right.
HPV,
Right. Right.
and then the doctor might say, "Oh, don't worry, just come back in a year." Don't, "Oh no, you don't need to do anything. Just come back in a year." And so the women go back in a year,
Yeah.
and now it's progressed. Now
Right.
it might be CIN1 or CIN2. And again, if it's CIN1, it's not advanced enough to require the surgeries that they offer. So they say, "Oh, just come back in another year."
Yeah.
And so then women are like, now they're in this later, once they find me and you, and find out, oh my gosh, I could have been doing something, then they feel really angry and betrayed, like, oh my gosh, I wish I would have known 2 years ago when this first came up positive that I could have been
Oh,
changing my diet, changing my lifestyle, healing from trauma, doing all the things so that it didn't progress. But unfortunately, women are it's progressing. Then they might have a surgery, let's
right.
say whether it's a leap or even a hysterectomy, and then to find out 6 months or a year later that now it's in the vaginal cells and it's
Yeah.
recurring, and and that's when sometimes women go, wait a minute, this can't be the only way. This
Yes.
can't be the only option. And I'm so glad that then they start searching and find me, and we can start helping them, because luckily it can still help at any point along that journey.
Exactly.
But
Exactly.
you and I know, like, that shouldn't have to be the experience.
Exactly. And that's where I feel in some ways we were more successful in preventing this before the vaccine because we didn't have a false sense of security.
Mhm. Yeah.
And I'm just astonished of how many like women don't know their bodies. So one of my favorite things when we would do those escharotics was I always had them take a mirror and like go with me on the process. And they were just like, what? Some people were like really taken back by that. I'm like, no, you need to see, this is your opportunity to see inside so you can help visualize what's happening and see it and watching it change from day to day to day as we would do the acetic acid and watch all the little white spots get less and less and less and less. And by the end of, a round of 5 to 15, depending on the stage, it would be gone. They would just watch this like beautiful healing process. The amount of pride and the amount of excitement around it. I had so many women bring in their partners, to like see this as well and just explain what was happening. It was incredible what happens when, I always say, an empowered patient is a very difficult to kill patient. And so, I'm on the other end of the spectrum. You see all the folks early on or preventatively, or maybe at that CIN 1, maybe 2. But once they move into the CIN 3 and beyond, that's where they land in usually my court. And you and I were talking before this, like, how do we help them remember that, let's say it has moved into cervical cancer? You said this so beautifully when we were talking before the recording, like if you do not deal with the virus or the reason why this cancer took root, no amount of chemo, no amount of surgery, no amount of hyperbaric oxygen and high dose IV vitamin C or vag packs are going to do it.
Absolutely. And that's in the standard medical world and all and oncology for cervical cancer, they're not addressing the virus at all.
At
In
all.
gynecology, they're not addressing the virus at all. And what I teach women is exactly what you started with at the beginning, which is asking the question why.
Mm,
And this is the thing of like, nobody's asking why. Everybody's just assuming, oh, I had sex, I got exposed to the virus, and that's why it's there. And I'm saying, no, okay, yes, you at some point you had to have been exposed to this virus,
right.
but that's not the whole story,
Right.
right?
Right. Because we're all like, I mean, the stats. It's been a while since I've kept on the stats, but, we're all being exposed to a lot of things, a lot of viruses, a lot of bacterium, a lot of molds, a lot of things. When our bodies are working well, they are able to, like this immune system is able to do surveillance and respond to those things favorably and keep the peace, if you will. Right. And repair if something was damaged, and take out the garbage where it should be. So this is what our bodies are constantly doing without us even knowing it, which is so, so beautiful. And the only time there's a problem is when there was something wrong, something went aloft in the management system,
Yeah.
right? It's not that the virus was the problem. It's that the surveillance wasn't on task or the removal of that debris wasn't working as well. That's what we keep coming back to of the why, the why, the why, the why. And if we don't get to that why, it will just keep coming back until we get it or don't.
And this is where I talk about it as susceptibilities. I find
Mhm.
that that word resonates, and it works for me too to explain like what is it that's because it's we also have to be careful to not be because sometimes we can feel hard on ourselves, critical of ourselves, or like what did I do wrong? And especially related to HPV, women have already a lot of
Stigma.
shame and embarrassment, and so it's like, okay, how can we be gentle with ourselves? And probably you do this with all cases you work with to be able to ask those hard questions. What
Yeah.
is it that I may have been eating or doing
Right. Right.
that actually was making me more susceptible to this situation that I can now forgive myself for and
Mhm.
change?
Right, right. It's so amazing. And one of the things I used to do when I taught up at the college, and I was working with like I think freshman and sophomore women were who I was teaching in Dr. Marcy Young's class, sociology and women's health class up there. So I always give Marcy a shout out. She's just an incredible human. But I would explain to these women like, let's all do this together. Let's everyone feel the back of your arms right now. Let's feel the heels of your feet. Let's look at your fingernails. Let's feel the cracks on the sides of let's see if you have any cracks inside your mouth. And if you get cold sores, like we were asking, like asking the question, just kind of going around the room. Those are all like People don't even think about them, right? And then whenever they would say yes to any of those, I would explain, okay, well, the bumps on the back of the arms, that's significant for vitamin A deficiency. And then I'd say, do you happen to notice if you have weird night vision or ever notice floaters? And a lot of them are like, oh, I do. I'm like, vitamin A is like nature's antiviral.
It is.
And it's like, that's just telling you right now that you're deficient in one of your first defenses. So then they're like, oh my, and then I'd go in through the rest, like the cracked heels, like essential fatty acid deficiency. So many young women, especially go into that fear of fat phase, and they go into their vegan diet phase and stuff, which is a huge population of that goes in and then further depletes those fat soluble nutrients, A, D, and K, the animal derived nutrients of vitamin D, vitamin B12, the soil depleted nutrients of magnesium. And then we highlight the fingernails. Like if you see little white spots, there's some zinc deficiency, also your first defense. So I would walk them through in their own bodies and ask them, like, where are you getting your B12? Okay, you're a vegan, so where are you getting this? Nope, it's not enough to get it from the algae. You've got to get the bioavailable kind. So are you willing to take a B vitamin supplement? And give praise to the donor of the life of that, Are you willing? Yes, you can get D2 from mushrooms, but that's not the bioavailable one that is required to actually turn on and off dozens of genes in your body and to instigate an immune reaction in your body. And the zinc is all about your hormone health too. Like what's going on there? If you're under high stress, you're going to see that zinc drop, and with it, your progesterone, and all these things that we could just like a simple nutritional physical in a class. And suddenly these ladies are out there like eating their fish, taking their cod liver oil, getting their sunshine, not being afraid of it, all of the things. It's like those are really critical prevention. And then we'd start to talk about the partners, like, okay, great. Is this person someone you want to merge with? Right? Like, think about that. Like, whew, if it's not, you got to listen to those signals because you're telling your cells that you don't love them when you're allowing somebody else to enter that space. No, without. Now, obviously, trauma happens where that space is taken from us. That's a whole different story, which definitely causes trauma to those cells and needs to be dealt with eventually. But I'm just giving an example of how different it would be having a conversation like that with a teenager, a young woman, a college student, versus here, just take this shot and move on with your life. It'll be fine. Like, what a different scenario, how that plays out. And a lot of those young women, there's several of those young women are now naturopaths, or in the allied health professionals, went on to be nurses in P's, and they're having these conversations.
Yes. Oh my gosh, I love it. I love it to be able to just bring it back down to earth, down to our bodies so that we can understand our bodies, connect with them, be in alignment with our body, right? Like, oh, this is what I teach women is like your body has messages for you, but we need to start listening and paying attention to be able to even pick up on the messages. And instead of being critical of the symptoms, be curious, right? Why am I getting these cracks? Why am I is that a nutrient deficiency? Is it something that I am, instead of just making a dietary decision based on some external arbitrary thing? But what are you really giving your body the nutrients it needs? And I love that you're mentioning this because I'm like thinking to myself, it gets me excited for what I cover I offer an online workshop that's free for women for around the world. And this is what I teach them in there is like, how do we start to think about this differently? And how do we start to take care of ourselves differently? Because already in these little steps, sometimes it seems so simple and so
Yeah.
small, but it makes such a difference. And I'm sure you see this too in your work and all of the people that you work with, right? It's just like sometimes we as naturopathic doctors, we come back to just the simplest from what are we putting in our mouth or not putting in our mouth? Are we getting sleep? Are we getting some time in nature or other recovery activities, right? Like coming back to these simple, basic foundational activities that humans require to be
Right.
healthy.
Right. The fundamentals, we call it the determinants of health in our world. And, I'm up at, it seems so obvious, and maybe that's why people don't listen. But it's amazing when you look at Americans on average, Americans spend less than 15 minutes a day outside. wow, when did that happen? Right? Like I always talk about the Little House on the Prairie days when we were literally just a century or so ago walking an average of 4 hours a day, chopping wood, carrying water, lots of exposure to the sun and the elements, and not having a 72 or 74 degree continuous climate. And then we were using things on our bodies like tallow soap and tallow on our skin, and we weren't using detergents to take away our most important, precious, absorptive surface and changing that. We were not eating foods with chemicals. I mean, today I have a sticker on my fridge that says eat organic food, or as your grandparents called it, food. It's like when we have to think about where it's coming from, what it's being, how is it got a weird peel thing on it? Is it like all these things like this didn't exist a generation or two ago, that's a lot of things we're exposed to today. And so going back to those fundamentals really are a return to remembering how we were actually divinely designed. And when you don't deal with those basic foundations, you don't receive healing. Like you can't heal in a sympathetic nervous state. That's why I love that this is your jam with stress and reset. Like I could have the best protocol, the best formulas, the best standard of care, the best integrative care, alternative care therapies. But if they're landing in a highly charged, sympathetic, dominant environment, they're not received.
Mhm. Yeah, because the body's just still is stuck in a stress cycle.
Yeah, yeah,
Mm.
yeah,
Now, I wanted to ask you if you don't mind as we're here is
yeah.
because I know like a lot of times when people are dealing with a cancer diagnosis, they start thinking of all kinds of like what else can I do?
Mm,
Now, you're training practitioners in your approach. You're training directly to people in your approach,
yeah,
and I'm thinking you start with these determinants of health we were just referring to. What do you say? But I know you also have a lot of training, and you teach practitioners around the world how to use other approaches, like mistletoe, for example.
yeah, yeah.
What what is that like? When do you decide? Okay, we're gonna think about these other approaches, and like when should a person be thinking, hey, maybe it's worth it for me to, and what does that look like to choose sort of these non-conventional approaches to cancer?
Mm, I love this question. To me, my why and my purpose on this planet now is to create a system where it's no longer perceived us or them, standard of care or alternative.
Okay, yeah.
That this elegant weaving of directly targeting the tumor while directly supporting the terrain go hand in hand without any division or siloing or judgment
Right.
or polarity. And that becomes standard of care. Like,
I'm totally with you. Let's do it.
right? And that is part of what we're building into. So, for instance, 70% of the clinicians that take my course are actually medical doctors. And the very first module, I basically give them a little course in naturopathic philosophy
Mhm.
because I say our training was the same. You can't learn biochemistry or physiology or anatomy, in any other way, right? But where our paths divided was in our philosophical approach, our philosophical understanding of what creates health and what creates disease.
Yeah, totally agree.
And so we get on the same page, but I use very scientific terms. I use the terminology we can all agree on. And it is just extraordinary to watch all these light bulbs click off. Even the naturopaths and the DCs and the osteopaths and the DOMs who come into the program, the light bulbs go off for them as well because Donnie, you and I have been in this profession long enough to watch that most of our colleagues don't even know the philosophy in which we practice from anymore. Right. And so even then they're like, oh my gosh, I totally remember this now. It's like we all come back together saying, let's look at true health creation, not just disease management. So that kind of creates the foundational layering. Then we have a methodology that we teach, not a protocol. And the methodology is really simple: test, assess, address, don't guess. Really simple. So, for instance, let's say I have a patient with HPV-driven cervical cancer, wherever it landed in the body, whether that was, or like, whether it's like showing up just in the cervix and beyond, or what, wherever. But HPV anywhere in the body, in the head, neck, in the rectum, it's the
Those
same.
are those are happening too.
Lots of them, right? And they're very similar personalities. It's viral driven. So let
Mhm.
me just like put this into your audience. When you think about a virus, does it make sense that you would give treatments that would further damage and destroy the immune system to deal with that virus? So, right there, it drives me knucking futs that we even have to have this conversation, because it's just common sense of, this is a viral. In fact, there are, well, to date, before COVID, I don't know what the stats are after, but before COVID, there were 250,000 accounts of Epstein-Barr virus-driven cancers in the world. There were about four, so they say up to 40% of all cancers are actually driven by a virus. So when you
Really?
think about that,
40%?
mhm, so like glioblastoma is a big one, of course, the HPV family, squamous cell carcinomas of various tissues where it lands in the body is also a viral etiology. Of course, CMV, Epstein-Barr, all of those are out there. We now are understanding that SARS-CoV is also a driver of many, many cancers as well. It's very specific to impact on the complex one of the mitochondria and the turning on of a PIK3CA metabolic pathway, which basically revs up growth factors in a really big way. So now we're starting to go, oh, but think about it. The way we approach oncology and standard of care is very, very immunosuppressive. Now, we're finally talking about immune activation with immune therapies today, but that can backfire too in about 80% of the patients. So we have to do better. So when I show patients the reality, it's like, how about we both go after the tumor and the terrain simultaneously? Then in testing, let's say that cervical cancer patient comes in. When we get that biopsy, we can find out, is it a squamous cell? Is it an adenocarcinoma? We'll be thinking about approach differently depending on which one. Then we will look at the Ki-67 score, which is a proliferation score. Like, how fast is this puppy growing? If it's under 20 or 25%, we've got time to be more judicious. We've got time to be more, let's take maybe a more integrative or alternative path before we get aggressive, at least to do so in preparing the body. If it's a high score, we want to be more assertive. We want to be more aggressive. We want to use other tools, but we want to use tools in a different way. So we can test now. We have amazing testing on blood biopsies or tissue biopsies to tell us exactly the personality of the tumor. And then we can know, well, what therapies from standard of care, from off label drugs, from alternative care address those particular patterns. And then we can even use them wisely, where we use the concept of metronomic treatment, where we take, say, a tenth of the typical dose of the chemotherapy and we layer it with other pressure point therapies, other oxidative therapies, like, let's say, 10% of oxaliplatinum, along with maybe a 50-gram bag of IV vitamin C, along on that same day with a hyperbaric oxygen therapy, a very highly oxidative therapy that both hits back the tumor but supports the terrain simultaneously. That's the example of where we're moving in the future of oncology. Luckily, this is happening in many clinics, but there are a lot of integrative oncology clinics out there who just throw massive amounts of very expensive protocols at the patient, and they're not using that finesse of the test to deeply understand the patterns of that individual, to deeply understand the best therapy to deal with those patterns. That's what I train into these clinicians. So they know the right dose, duration, combination. They know when to, what I call, push or pause, depending on metrics of the how the patient feels, but also certain labs. It's easy for us to look at labs that show extreme oxidative stress. When you see that, that is not a time to keep pushing. But
Mhm.
that's exactly what we do in standard of care. And even the way we approach standard of care, it's called maximum tolerated dose. So the concept of literally napalm the field and hope something survives. But there's this emerging approach known as the adaptive theory, which is very much in alignment with naturopathic philosophy, which says push it back just enough so that the wisdom of the body, the vis, can rush back in and do what it was divinely designed to do.
Love it.
That's the difference of how we might approach this, that we don't say, oh, boo on chemo or boo on IVC. There is a time and a place, and they can play very, very well together, and they can be very, very curated and personalized.
Yeah, that's amazing. And I'm starting to see that too. And I'm so glad to hear your explanation of it, because it's like, hey, we're taking the best of both worlds and finding a way where we can be outsmarting the situation
Mm,
instead of just being in a defensive mode. We can be like, right? Like that's part of the difference is like, hey, instead of just being in fear and acting out of fear and defense, how can we understand the situation and then be supporting the body to heal itself, which is really the philosophy of naturopathic medicine.
yeah. Yeah. And medicines before us, right? The almost all of the vitalistic medicines from Chinese medicine, Ayurvedic medicine, these are the grandmothers and great grandmothers of even modern medicine. I mean, we learned surgery from the Ayurvedic practitioners. We learned from most of our pharmacology from the Ayurvedic medicine. So we are applying those principles today, but we kind of threw away all the wisdom and the
Mhm.
philosophy when we deeply adopted just the antibiotic, anti-hypertensive, antidepressant. We forgot to say, well, what's the pro?
Mhm.
you know? Yeah.
Amazing. And
Yeah.
so essentially, like, so you're saying, hey, let's find out the behavior of this tumor,
Mhm.
and then let's match that up with, you can have a whole endless list of possible treatments. But
Exactly.
why do all of them if they're not all going to help with this tumor? We need to match the tumor to the treatment.
It's almost like today, I feel like we have gotten to the point in standard of care oncology by the way we can test. It's almost like repertorizing the tumor.
Ah,
And then we get to choose the proper remedy, from a very homeopathic, non,
so much sense.
and that's where I think that's why my brain got this so early on, is because I was always sort of coming from that vitalistic approach. And it's so cool to watch that this is a common language now that we can use,
Mhm.
you know? Um, it's exciting to me because I do feel hopeful for the first time in oncology that we might be getting somewhere.
And it makes me think is like even those cases back of, because in the case of cervical cancer, we are catching before it turns into cancer. We can see these cells when it's mild dysplasia.
Yeah.
It makes me wonder, like, could we even get some of that information at that stage
You
to
can.
potentially modify what we're doing?
Absolutely. This is what, in fact, I had a call today with a testing company that is doing just this. He does a metabolomics with this YC at the end. Dr. Nagorny out of California is able to actually see the pattern of the person at the time that you find maybe a precancerous biopsy, or just this is even because he can use this even after you've been diagnosed with cancer, but he's ideally trying to head everything off at the pass, right? And you can already start to see the what's in motion that might need to be addressed.
This is really cool, and I'm sure that's, like, part of what we're already doing. Because I agree with this. Why guess when we can test? We can
Totally.
test for, food sensitivities, for leaky gut, for microbiome imbalances. We can test for nutrient deficiencies. We can test for cortisol levels. We can get this information, but
Yeah.
women are not getting this information in standard medical care, and so they are like in the dark. Well, how do you're like,
Yeah.
what food should I avoid? What
Right.
is, microbiome? Okay, but just taking a probiotic at that point is probably not going to do it. We need to get more specific to be able to say what exactly is out of balance so we can address it specifically. And that's what I've, from where we learned about addressing HPV over 25 years ago. That's where that's where I've taken it, is to say we need to be able to test and see in this person specifically what's going on in their environment that's allowing this virus to
Mm.
cause abnormal cells. And once we address those things, then of course the virus is going to give up. It's like the virus is like, I don't want to be here anymore. This is
Yeah.
not a place for me anymore.
Yeah, exactly. Exactly. And that's the beauty, is it should not be an either or. We have come so far that we have these amazing tools that we should take more advantage of.
Mhm,
Yeah.
mhm. Yeah, yeah, and it is possible to get access to them, and we don't have to be limited by location or time or space. We can talk. Oh my gosh, thank you so much, Nasha, for getting this is it's so exciting to get to talk to you and hear everything you're up to. I'm so grateful for you for training all these practitioners and helping so many people in the world. And I'll definitely be sharing your book, The Metabolic Approach to Cancer, and how to reach out to you so that anyone listening who wants to learn more, maybe if you're a practitioner and you want to learn, you can go to the Metabolic Regen University, and you can, and if you're not a practitioner, if you're even a layperson who's dealing with cancer, you can go and start to learn how to heal yourself in this way.
Oh, I'm so grateful. And I'm so excited that you get to come on and have a conversation on my side of the screen.
Let's do
But
it.
it's an absolute joy. I mean, boy, howdy, there were so many pieces, like so many elements we probably could have gone on and on about, but just a delight to be in conversation with you and just to be in your beautiful presence. So thanks, Dr. Donnie.
Thank
Yeah.
you. Thank you so much. And thanks everyone for listening in. Please don't hesitate to reach out to either of us if we've inspired a question for you or curiosity and how we can help you. And if you haven't already, then please subscribe to How Humans Heal so you don't miss the next episode. Thanks, everyone.
Goodbye, everybody.
Thanks for listening to How Humans Heal. If you liked this episode, leave a rating and a review. And for more resources, visit drdonnie.com.